Uganda AIDS Commission reported a huge funding gap to HIV/AIDS response, partly attributed to the emergence of new epidemics. Uganda's health budget, which covers HIV response, is heavily reliant on donor funding up to 80%.
In the year that we reviewed, we noted that there was a funding gap of 450 billion Uganda shillings. This is an increase from the funding gap that we had established in the year before, the year 2020-2021.
AIDS is killing people too, but it's not obvious to us, and the spread is probably not as rapid. But when the pandemics come, any person, including you in a home, you would shift the resources to what is posing immediate threat, and that means areas like HIV now start suffering.
As new pandemics threaten global health financing mechanisms, Professor PLO Lumumba thinks it's time that African countries started looking inwards for HIV response funding.
Africa must stop that. The representative of PEFA will be speaking a little later. I would want to have a conversation with her. When are you leaving? Because she must leave. Because if she does not leave, then we are not going to grow.
He was the keynote speaker at the closure of an HIV/AIDS symposium in Kampala. MPs passed the HIV and AIDS Prevention and Control Act in 2014, providing for an HIV/AIDS trust fund through which government would levy taxes on alcohol and soft drinks to fund the fight against the disease.
Program on HIV/AIDS is run from the office of the president, and yet the HIV trust fund is not established. When you are talking about the annual milestones, what do you tell the president? If the president is talking about the parish model, is the parish model not impacted on negatively by HIV/AIDS?
Government is committed to gradually reducing the dependency of health financing on the donor support.
Lumumba thinks the fight against HIV and AIDS should be looked at in the East African regional perspective, given the porous borders.
I see the Ugandans are making promises to themselves, and I do not begrudge them that by the year 2030, HIV will have been eliminated. Have you talked to the Kenyans? Have you talked to the South Sudanese and the Burundians and the Rwandans that they are doing the same? If you have not had that conversation, that is a hollow promise.
The professor called for increased funding to the health sector, actualization of a health insurance scheme, and an end to corruption as ways of supporting the HIV fight. Edward Muhumza, NTV.